Hello everyone. I hope you all are doing good. I'll wait till we can get connected to you guys. I hope you had a wonderful week earlier and wish you a good week ahead. Thank you for joining everyone. Thank you. Oh, this is a live session with a doctor. This is not 10 minutes for MS Live. Okay, thank you everyone for joining us today. I'm very excited for this session. I have been, really wanting you to meet a special guest today that we have. Her name is Dr. Cyrus Danzig, and she is super amazing. She is a MS warrior by herself, and she's an advocate, an author, a film producer, and she's the one who has. Hi, doctor.
Hello.
How are you?
Good. How are you? I'm so happy that technology is working this morning. I was getting a little nervous.
No, it is working fine, and I'm so excited to see you. I've been waiting for this moment.
Oh my goodness. I just want to apologize. I know we've been trying to do this for so long. My schedule's been so crazy, but I'm so glad we were able to make it work this morning.
Absolutely. Thanks to you for taking out time to do this. And not only me, there were so many people who actually messaged me and said, oh, finally you got this doctor on your show. Everyone was so excited.
And I just want to say congratulations on your beautiful Instagram account. It's just really so wonderful. It's so informative. I know that it helps so many individuals across the world. So thank you for the important work that you're doing to educate and empower those of us living with multiple sclerosis.
Thank you so much, doctor. I can do little things from my side, but I cannot be like what you are doing is incredible. I mean, you are sharing your MS journey. You have written a book, What's Missing from MS. You have documented a movie, which is Code Blue. And I mean, the list just goes on. And you have your own ways to deal with MS, and you are actually advocating MS. So that's incredible.
Well, thank you so much. And we're all working together to support individuals. This is a very difficult disease to live with, as you know. It's not the same in any two people. So there's a lot of confusion. And so I love the small little bits of education that you're able to share with community every day. They're so beneficial and they're on point. So thank you for that.
Thank you so much. It's a pleasure to hear such nice things from a doctor like you. I'm honored.
You're very welcome.
Thank you. You're already so kind, and I don't have words to say. So let's start with the session today.
Sure.
Doctor, I know a lot about you by reading about you and visiting your website and following your page. But can you just tell a little about your journey about MS and how did you as a doctor deal with it?
Sure. So I'm an infectious disease specialist physician. Back in 1995, when I was a young medical resident, I was on call one night, and it was a really busy night. And I found a little bit of time to take a nap in the mid-morning hours. And when I went to the call room, I fell asleep right away because I was so tired. And when I was paged about a half hour later, I couldn't get up because I couldn't feel my legs. And it happened that acutely and that immediately. And so I panicked. I was in the middle of this on-call session. I had no idea what was going on. Next thing I knew, I was in the emergency room, and they conducted a MRI of my brain and spinal cord, and those studies confirmed a diagnosis of multiple sclerosis with multiple lesions in both my brain and spinal cord. But it was, it took my breath away. I thought when I came into the hospital earlier that morning, I was a young, vibrant, healthy woman. And all of a sudden, the floor had been pulled out from under me. And I was told I had multiple sclerosis and I had multiple lesions, a lot of burden of disease in my imaging studies. And so my doctors prepared me for what they felt was a future likely dependent on a wheelchair. And actually at the time, Ritu, they told me I was lucky because the very first disease modifying therapy had just been approved by the FDA a medication called beta seron in 1995, and they told me this was important that I start it right away to slow the progression of the disease. So of course I was going to do everything they asked of me. I didn't want to be in a wheelchair. I wanted to live a normal and healthy life. And so in 1995, I started beta seron, which is a medication, as you know, a disease-modifying therapy that I would have to inject every day. And it has a significant side effect profile.
Oh, yes, yeah.
And I experienced all of those side effects. I would inject the drug in the evening around 10 o'clock. And then at 2 o'clock in the morning, I would have awakened with, violent shaking, chills, fever, nausea, vomit. It was just really, really terrible. And so I did this over time, and I didn't think I could do it much longer. So when I went back to my doctors to tell them I couldn't stay on this medicine because of the side effects, they then said to me, well, you have to stay on the medicine because the wheelchair is waiting for you if you don't. And so they advised me to take other medications to treat the side effects of this drug. So when I couldn't sleep, I was given Ambien. When I couldn't wake up, I was given Provigil. And when I became depressed, I was given Prozac.
Oh my God. Yeah.
Within a few years, I was taking about a dozen medications. And despite being compliant with recommendations by my physicians, my disease progressed. I was having regular exacerbations, probably twice a year or 3 times a year. And each time I had an exacerbation, I would lose some function. 8 years into the diagnosis, I became dependent on a cane or set of crutches, and I was really struggling.
And so, doctor, did the doctors tell you that how old was that disease in you, the MS?
Yeah, it's really hard to say. When I look back, there were so many little symptoms and clues that I ignored because I just assigned them to something else. Like, for example, throughout medical school, I could never sit through an exam throughout the whole time. I had to go to the bathroom. That was my bladder affected from the MS. Or I always had so much fatigue. But, I was a medical student and a medical resident, so I just thought that was part of it. But it was really that drowning fatigue that MS patients experience. I was living with that, and I just didn't know what it was. Or sometimes I would feel tingling in my toes, and I thought maybe it was my heels, so I stopped wearing heels. I would always account it to something else. So I probably had this disease for some time before it was ultimately diagnosed. But on that evening, I think the stress of everything that I was in my life, there were so many stressors. They all came together, and it was like the camel, the hair that broke the camel's back. It just tipped over, and that's when the diagnosis presented itself.
Oh my God, that's really heart touching, the diagnosis. And, you have been a doctor, you've been a medical student, and you have been yourself ignoring the symptoms, because it happens that when you are too busy or too stressed in your studies, you feel, oh, it's just a part of it. Maybe I did not sleep well, or I wore heels. And then something comes up and just changes your life, just turns around your life completely. That's Absolutely. Quite a shocker. So I understand it must be a difficult thing to accept the diagnosis, and especially when the doctors said that you would be on a wheelchair. That's the most scary thing that anybody would hear. So when you wanted to stop your DMT and move to a more healthy or natural way, so what was the reaction around of the doctors?
Well, and I want to make one point, Ritu. It's not that I'm against disease-modifying therapy. I think disease-modifying therapy can be a very important part of managing MS. At the time, for me, there wasn't the different options that there are available today. And the drug that I was taking was really, for me, very difficult to manage because of the side effect profile. So I just want to make that point, because I don't want MS patients to think that I don't think disease-modifying therapies are an appropriate part of managing the disease. Of course, in 2003, when I approached my doctors letting them know that I had read so much of the literature that spoke to the importance of diet and lifestyle in managing MS that I felt that I had read enough evidence that supported that this could be a potentially helpful part of my management plan. At the time, my doctors didn't really buy into that. They weren't very supportive of it. But the life that I was living, the quality of life was so poor that I felt I needed to do something to take control of the reins of my own health. So in 2003, I decided to change all these aspects of my lifestyle. And the most important aspect was my diet, right? So I read in the scientific literature that the ideal diet, the optimal diet for all of us, not just for MS or diabetes or heart disease, is a diet rich in plant-based foods. So in 2003, I adopted a whole foods plant-based diet. I began to exercise. In the 1990s, believe it or not, exercise was falsely believed to worsen MS. So I was told not to exercise. So I was highly deconditioned. I hadn't done anything in 8 years. I know you're familiar with Odhoff's phenomenon. When your body, when you have multiple sclerosis and your body temperature goes up, your symptoms worsen. So back before we really understood, it was thought that this was worsening the disease. We know that's not true today. So in 2003, I was so deconditioned, the only thing I could do was to get onto a stationary bike with my husband's assistance. And then I could do a minute or two, and then exhausted and in pain, my husband would carry me off, and it would take 10 to 15 minutes to recover from that, because I would get numbness, and then, you know, the tingling in my legs as I recovered, as my body temperature came back down. But every day I would get back onto that bike and I would do another minute. And then before you knew it, I was building a minute and a half, 2 minutes. And over time, I built strength and endurance. Stress, I brought my team together. At that point in 2003, I was the chief of infectious diseases at the VA of New York. And I told my team that I was going to leave every day at 5 o'clock unless there was a patient emergency. And I wasn't going to take on that extra research project or that extra clinic time. For the first time in my life, I was going to put myself first. I learned how to sleep, Ritu. Oh my goodness, I was dependent on hypnotics like Ambien and benzodiazepines like Ativan. I didn't know how to sleep. So I learned everything I could about sleep physiology. I created the right environment in my home. I understood the importance of sleep structure. And you know, it was probably one of the hardest obstacles that I had to overcome. But learning how to sleep was such a game changer for me. Now I'm such a good sleeper, and it's really been so beneficial to me. And so all of these changes, it didn't happen in a week and it didn't happen in a month, but I started to feel better, you know, and at first it was something as simple as I could stay up past the evening news, or on another day, I got to the hospital and I would typically park my car, and then in my back seat, I had a cane that I would pull. I remember one day I got to the hospital and I felt confident enough not to get the cane. And so it went like that. There's always one day that sticks to my mind, and I always share it when I talk about my MS, and that's July 2nd, 2005, because on that day, I did two things that I didn't think I'd ever be able to do again. I went to a wedding with my husband on that day, and I wore heels and I danced with my husband. So it was really, it sounds trivial, but you know, these are small wins in the right direction. And then as you know, I continued to improve and empower and get better. And then in 2010, I ran a marathon. And it was a very special moment for me because I never, again, it was something that I didn't think I was capable of doing. And so it's that experience, my personal experience with really understanding how powerful these sort of mundane decisions we make every day, we sort of take them for granted. We don't really think about how powerful they are and what influence they play in our health outcomes. And myself as a doctor, the other piece here that's missing and it's the reason I entitled the book What's Missing from Medicine, is that when I went to medical school, I didn't learn anything about the importance of diet and exercise and stress and sleep and social connections and the avoidance of substance abuse issues. There's no emphasis placed on that in medical school. And we know in the literature, we know that we could prevent 80% of the chronic diseases that people suffer with. And yet in clinical practice, we don't talk about this. And so part of my work is not only sharing my message with community and empowering patients, but it's also about creating change in medical education so that all doctors are speaking to this ubiquitously and unanimously. And I think if we did, we could prevent so much chronic disease and improve the lives of so many people across the world.
Oh my God, this is so amazing and so inspiring. It's not just inspiring for us MS warriors, but also to the doctors all around who can actually turn around what they study, what they learn, and just look at things from a new perspective. We have examples like you who have really proven the science wrong and treated themselves, in certain way when things were forbidden earlier, like workout. It was said that should not be doing. So who was your inspiration that time to actually do all these experiments on you first and then try to heal by anyway?
What was the inspiration for me? Yeah. So it came. This is a funny story. It came in 2003 when I was really at my worst. It was like my darkest moment, and I was sitting in my office in New York, and my secretary walked in to deliver the Daily Mail as she would every day. On this day, though, Ritu, she dropped this stack on my desk, and on top of this stack there was a journal. And on the cover of the journal, I saw the words multiple sclerosis and blueberries. And I thought, what in the world could blueberries have to do with multiple sclerosis? So I dropped everything. I picked up the journal, and there was a very small study in the published in this journal. It was very unscientific and poorly constructed. They took a small group of MS patients and they fed them a diet rich in blueberries. And the authors went on to conclude that the patients who consumed this blueberry enriched diet subjectively reported that they felt better, less fatigued. Now, I was a scientist and that wasn't a very objective clinical finding. I thought this was so silly. I couldn't believe anyone had published such an article. But there was something about this silly little blueberry study that I couldn't get out of my head. And it wasn't that I thought eating blueberries was going to solve my problems, but for the first time in my adult life as a practicing attending physician, dual board certified, I considered the following question. Could there be a connection between diet and MS?
Yes, it happens.
It was amazing. And then I said to myself, my goodness, if anybody could answer that question, you think I'd be able to. I was a doctor, right? 4 years of medical school, 4 years of internal medicine residency, and another 2 years as a fellowship, 10 years of my life dedicated to higher education in the field of medicine. And I couldn't think of any examples in which one of my professors, mentors, or educators ever connected those dots. But I remained curious, probably because I was desperate. So I turned to the scientific literature. I went to PubMed, the search engine, and I put in words like chronic disease and diet, multiple sclerosis diet. And what I got back was this huge amount of evidence in the literature that was so exciting and created so much hope in my heart that this could potentially play a role in improving my quality of life. So that's where it started, with that silly little blueberry study. And that opened up this world of evidence in the literature. And then it wasn't just food. It was the importance of exercise. It was the importance of mindfulness. It was the importance of sleeping effectively, of avoiding alcohol and tobacco and other substance issues of abuse, and the importance of social interconnectedness, the importance of love and connections, and how that fuels your heart and it prevents the development of chronic disease. My hope, Ritu, for each and every one of us is that we age gracefully, free of chronic disease, and on that last day on planet Earth, that we are surrounded by those we love, and that on that evening, after spending this beautiful day with your family and friends, that you pass away peacefully and with dignity and without all that suffering at the end of life, which is so much of what we see today in this world.
God bless you. This is so beautiful. Yes, nobody deserves to suffer like it. You
No,
have to be responsible for your own life, and for that you have to work for
you
your
do.
body.
You do.
And you have to be disciplined with regards to your diet and exercise and sleep and stress and social circle. So, Doctor, if can I just take a few questions that are coming on the screen
Of
in between?
course.
Yeah.
Sure.
So I have this question here about sleep. How
Yeah.
did you change your sleep disorder, and you changed it from what to what?
So, well, the way I was sleeping for 8 years was by taking a hypnotic Ambien, a medication, right? So I didn't know how to sleep, and prior to that, I can say even before my diagnosis, I was a very poor sleeper because uh, I would go to bed and then worry about medical school, worry about my residency, worry about my exams. So I was a very stressed out young lady, very anxious, right? So what I learned with sleep is that it's very important the environment that you create. For example, your room should be cool, dark, and quiet, right? There should be structure around your sleep, meaning that some people go to bed at midnight or 1 o'clock one day, 11 o'clock another day. You should have structure, meaning that you should pick a time that you go to bed. Let's say it's 11 o'clock, and then your wake up time should be 8 hours later. And you should stick to that 99% of the time. Obviously, there are days like New Year's Eve where you're gonna be out and you'll be about. But if you keep to that structure, your body will get accustomed and know it's 11 o'clock. It's time for me to go to bed. It's 7 o'clock. It's time for me to wake up. And even on the days where you feel like, oh, I want to get some extra sleep, no, you get up on your structured time. So that's how you create good, effective sleep hygiene. Addressing issues like making sure that you're not drinking caffeinated products late in the day beyond noon. Making sure that you're not drinking alcohol at night. Drinking alcohol at night will affect your sleep cycle. Eating too late will affect your sleep cycle. So there's a lot of important parameters, which is what we call the pre-sleep ritual, that are important. And I write an entire chapter on sleep in my book because it's such an important aspect of maintaining good health.
Wow. So, doctor, yes, sleep is important, but MS also has a problem for insomnia. There are so many people who suffer with it. So
Yes,
they,
and
try different methods, but
yeah.
they have to ultimately depend on medicines.
Well, yes, some do. But if you create an optimal sleep environment in your home and you practice these principles, you'll be surprised. I have had many MS patients who learned how to sleep really effectively, but it takes, like you said, discipline. Going to bed every night. I go to bed at night every night at 9 p.m. and I wake up at 5 o'clock. There's some discipline involved there, right? In the morning, I wake up, I practice meditation, and I exercise. Again, it's discipline. It's what you're willing to put into if you want to work hard to becoming free of medication as relates to your MS, you can do. I mean, for sleep, you certainly can do it. The other issue that many MS patients have, which I have myself, is bladder issues. So you have to get up in the middle of the night multiple times to go to the bathroom. I have to do that. I probably get up 2 to 3 times in the evening during my sleep, but I go right back to sleep.
What happens that usually when people get up, the first thing they do is just take the phone and see the updates
Right,
on the phone.
exactly. I mean, the phone is doing so much damage. The minute you look at that blue light, it affects melatonin being released from the brain, which is that trigger for sleep. And so that creates poor sleep hygiene. So it's really important that you address all these. I mean, people get into bed and they're answering email and looking at text messages or checking their Instagram before they go to bed. You shouldn't have any computers or laptops or iPads or anything anywhere near your bedroom or televisions in your bedroom. This is part of creating a healthy environment in your sleep environment.
Usually when people buy their house, the first thing is what they do is, this is the master bedroom and here the TV will fit.
No, the TV does not belong in the bedroom at all.
Such a learning, yes. So, doctor, when we're talking about other factors affecting our body, the one big factor is the diet, like you said.
Yeah.
So, what do you suggest? There's so many theories and there's so many kinds of diets: the Swank diet, the paleo diet, the keto diet.
Yeah, that's all silly stuff. There is no diet. It's about eating primarily plants. Okay. I know there's a lot of confusion out there and people have programs and diets. You should eat a diet that is rich in plant-based foods. And the reason why is because plants are rich in fiber, right? And
Right.
fiber is so important in creating a healthy microbiome, right? So the microbiome is this huge organization of bacteria, virus, and fungi that live in our gut. We have about 3 to 5 pounds of bacteria, virus, and fungi that live in our gut. And when we eat a fiber-rich diet, we enrich the good bugs, and these good bugs in turn make positive chemicals that then affect our immune system. And we've seen this. There's evidence in the literature that shows clearly that MS patients who eat a fiber-rich diet change the makeup of their gut. And these gut bacteria, there was one study that was published in Milan, Italy, which showed an enrichment of an organism called Lactobacillus, and that bug makes something called butyrate. And butyrate affects the immune system, those T cells and B cells that are critically important in triggering that immune response in MS. It quiets them. Okay, so don't let anybody confuse you or make this all too complicated. The ideal diet for all of us is one where the plant is at the center, which is the most important part of our diet. I don't personally eat any animal sources, but it's up to you. If you're going to consume animal sources, it should be the minority, and you should cut out any processed foods, because processed foods are just layered with sugar, salt, and fat, and
Yes.
they're not healthy for your MS, and they're not healthy for anything else. We don't want you to get diabetes, heart disease, breast cancer, Alzheimer's disease. All of these chronic diseases are interrelated. At the end of the day, the nidus, or what catalyzes or stimulates all of these pathologic states, is inflammation. It's inflammation. And so when you, and the nice thing is, when you engage in these healthy behaviors, for, let's say your audience is interested in multiple sclerosis and they want to change their lifestyle because they want to better manage their MS, guess what? They're also going to reduce their risk of diabetes, of heart disease, of cancer, of Alzheimer's disease, all those terrible diseases that can be part of our lives. You can reduce them dramatically by engaging in these healthy behaviors.
All right. And so, doctor, what are your thoughts on gluten and dairy?
So dairy, there's a lot of evidence that dairy should be excluded from the diet, and there's a myriad of reasons for that. As far as gluten is concerned, I know there's a big push in the autoimmune space for a gluten-free diet, and I'm not there yet. I don't consume a gluten-free diet. The evidence for me is just not there. I think you have to take each case individually. So it's important that each patient be evaluated by their physician. But I think to give a blanket statement that all patients with an autoimmune disease should go on a gluten-free diet, I wouldn't agree with that.
I'm so happy to hear this statement. Trust me, it's difficult to be gluten-free when you are an Indian.
Yes.
Yeah, but okay. So
I mean, if you have celiac disease, obviously, yes, you need to be on a gluten-free diet.
Yes, absolutely. So, doctor, I'm getting like so many questions here, but so the next question I'm getting is about stem cell therapy. What are your thoughts about stem cell transplant? Would you ever recommend it?
For MS patients?
Yes.
Yeah. To be honest, I don't know enough about it to either recommend or not recommend it. To my knowledge, it is not yet approved or supported by any major organizations. But I don't know enough about it to comment. Let me just say this, I'm not a neurologist or an MS expert. I'm an infectious disease physician, I'm an internist, and I just happen to have MS.
Absolutely. Thank you, doctor. Doctor, my other questions to you is about supplements. That we know that everybody is taking loads and loads of supplements every day, but is there should there be a full stop to it, that you should not take so many supplements every day, or you should take for 3 months and stop? So what are your thoughts on it?
Yeah. So supplements, I have a lot of concerns as it relates to supplements. And I'm going to tell you a quick story in my own personal life. I shared this in the book. And I'm also going to give a talk on this in October at a conference that I'm attending. Back in 2005, when I was feeling so good from changing my lifestyle, I read a book. I'm not going to say who it was who wrote it, but in this book, this doctor recommended a lot of supplements, a lot of different supplements. And in his book, he offered evidence as to why it was beneficial to consume these supplements. And he sold a line of supplements. So I read the book and I said, wow, I feel great now just with my lifestyle changes. Maybe if I add supplements, I'll feel even better. So I started taking these supplements, and about 3 months after I started taking these supplements, I wasn't feeling so good. I started to lose weight. I started to vomit. And I called my friend who was a physician, and I told her, she's, oh, you're probably pregnant. And I said, no, there's no way. She'd come in and we'll do a pregnancy test. It was negative. And then she did blood work on me, and she calls me and she says to me the next day, she says, meet me in the emergency room.
Oh my God.
Yeah. So I ended up going to the emergency room. My liver enzymes were sky high. I had developed something called drug-induced liver injury from supplements.
Okay.
Okay.
Oh my God.
I was in the hospital for 2 weeks, and I was being considered for an evaluation for a liver transplant. And so the reason I tell this story is because people think that are, natural, but we don't know enough about supplements. They're not fully studied. The rigors of, like, for example, when a drug gets approved by the FDA, there's a lot of steps that need to be undertaken to ensure that it's effective and safe. We don't have those same standards in the supplement industry, so we have to be very, very careful. Sometimes we read a book or we read an article with a list of medicines, and they're listed as natural, and we don't know enough about it. We don't know, for example, if they interact with a medication that we're taking. So we have to be very, very careful. Any supplements that you take, make sure that you tell your doctor that you're taking them, and understand that it's a drug too, and that it's not just something that you should ignore or not share with your physician. So we have to be very careful. I am not a big fan of supplements. I think there are certain supplements that we do need to take, like, for example, vitamin D, especially in those of us who live in parts of the world where we don't get enough sunlight throughout the year, like where I live in the Northeast, near New York City. So vitamin D supplementation, those of us who are strictly plant-based, B12 supplement would be an important. But beyond that, just be very, very careful and make sure that you discuss whatever supplements you take with your doctors, and always be wary of any claims that are made that may or may not be true.
Oh my God, that's quite a shocker, because every time we hear is like, supplements are good, you should add this to your diet. These are supplements you should have on a daily basis. I know a few people who take like 30-35 supplements daily basis. And
I know. There's a lot of that going on, and it concerns me because we don't have the evidence to support that that's beneficial. For me, it's always about remaining as objective as possible, looking at what the science tells us. And then, I think I have to be responsible in that way to assure, above all, we do no harm.
Right. Thank you so much, doctor, for opening our eyes with regards to supplements, which was really, really necessary. Doctor, I have a question here by Russell News saying, since MS patients are at great risk of thyroid, what can one do to remain healthy and stay away from thyroid disease?
Well, whenever you're diagnosed with any autoimmune disease, you're at risk of developing a second one. So I think what the person is asking, like Hashimoto's or hypothyroidism.
Yes.
So yes, it's true that MS patients and any autoimmune disease are more likely to develop a second autoimmune disease. But again, what I would say to you is, if you practice, the idea is that if we practice optimal lifestyle, we're going to reduce our risk of developing a second autoimmune disease or developing any of the other chronic diseases that I just described, like diabetes and heart disease and obesity and all the other issues that we face day in and day out. Not just in the United States, but all over the world, obesity rates are climbing. And diabetes rates are climbing. In our country, when I was a young medical student, rates of diabetes were only about 2%. Today, they're 10%, and the CDC predicts that by 2050, 30% of Americans will be living with diabetes. And diabetes is, of course, not only a problem here in our country, but across the world. We're seeing huge increases. Absolutely. So for the individual who asked about what can we do to reduce our risk of thyroid disease, the very same things that we're talking about. It's diet, it's exercise, it's stress, it's sleep, it's avoiding tobacco and alcohol and any other substance abuse issues. And also, social connections are really, really important. People often say to me, well, Dr. Stancic, you're a physician. Why are you talking about love and connectedness? Because the evidence in the literature tells us that those of us who are most connected and have surrounding individuals who are supporting us, that reduces our risk of developing chronic disease, and it reduces improves our likelihood of living long and healthy lives.
Absolutely. So it is said that when you're surrounded by people, the positive people, the people you love, you feel happy inside, and the stress level, of course, comes down, and you feel motivated, and you want to get better for them, not only for yourself. So you have that kick, and you want to discipline your life for them, not just yourself then. So it's a connection. I absolutely agree. So doctor, when we're talking about diabetes, I can see Sab has questioned that fresh juices have too much sugar. Do you think we can have fresh juice?
Yeah, well, it's true. Whenever you take the fruit and you squeeze the juice out, you're taking away the fiber. So the fiber. Remember, we talked about fiber being the key and being so important. But if you're not diabetic and you want to enjoy some juice on occasion, that's fine. But I wouldn't have juice every day. The idea is to eat the whole fruit, because the whole fruit is going to deliver all of those important antioxidants and phytonutrients and fiber, which are all of which are key components of a healthy diet. We talked about the blueberry earlier. The chemical that gives the blueberry that beautiful color is called anthocyanin, and it's a very powerful antioxidant phytonutrient. So what we want to do is, in any scenario, particularly somebody who's living with an autoimmune diseases, we want to infuse the plate with foods that are colorful, right? Because it's those colorful foods, those plant those foods, like those colors that you see, those are phytonutrients, phytochemicals that are so important in cellular health and helping us to maintain and prevent disease.
All right. Thank you, doctor. Doctor, I have a question here about infection. So MRZ Kelly Baby has written, can you please answer my question about parasites in the nervous system? Is it true that this is the cause of multiple sclerosis? And why aren't patients tested and treated for parasitic infections?
Well, to my knowledge, there's no evidence that parasites are the cause of multiple sclerosis. In fact, I don't think we know exactly yet what is the ultimate. There have been a lot of theories over the years. They're not yet quite sure what causes multiple sclerosis. There is potentially a genetic component. But we don't know. We do know that in the past 20 to 30 years, there has been an increase in not only multiple sclerosis, but a lot of autoimmune diseases. And so there are many theories as to why that might be. It could be, one of the leading theories is the hygiene theory, where, in the past, we were exposed to much more infectious diseases, right? When we were kids, everybody naturally got the chicken pox, or we played outside more, and so we were exposed to more organisms. So one of the theories is that our immune system nowadays is not as mature as it was in the past.
Absolutely.
because we're not getting as many exposures. Another theory is the obesity theory, that excess fat is contributing to an increase in autoimmune disease. And then there's also another theory that it's related to stress and increased substance abuse issues. So there's a lot of leading theories, and I talk about these in the book as well. But we don't know exactly what is the component that is leading to multiple sclerosis as of today.
Okay, thank you, Doctor. Doctor, I have a question here by Scorpio. She has written that I try to remember to eat 90% plants, but I still have memory issues. So how can I improve my short-term memory?
This is an individual who has an MS?
Yes, she has MS.
Okay. Well, memory issues can be multifactorial, so I would definitely want her to discuss this with her doctor. And again, it's not just diet; it's all the other aspects of lifestyle that need to be addressed, right? So I would want to know what her exercise is like, what her sleep is like, or I'm assuming, or I'm assuming this is a woman. I apologize. It could have been a man who asked the question. But the point that, you know, in my book, Ritu, I use the example of a wheel. So there's 6 pillars or aspects of lifestyle medicine that we address. As I mentioned earlier, it's diet, exercise, stress, sleep, social connectedness, and substance abuse. So in my book, I use a wheel, and I use the instead of pillars, spokes. And the reason I use that imagery is because I want individuals to understand that they're all interconnected, and they're all relying. Some of us are so good at our food, and we spend so much time, you know, optimizing our diet, but then we ignore our exercise. Or we're so good with our exercise, and we don't address the 3 glasses of wine we're having every night. Okay, so it's really important that it's a holistic, comprehensive evaluation that needs to be completed. So I would ask this young lady to address all aspects of lifestyle to assure there isn't anything that she's missing. And then at the end of the day, she's still living with multiple sclerosis, and you know, there are unpredictable issues there. I have occasional symptoms every day that I experience, and I live with them. It's just part of what we live with as individuals living with multiple sclerosis.
Yes, Doctor. Thank you so much. Doctor, we've been talking since last 45 minutes and the time just flies.
I know.
If you don't mind, I'll just do the last question and then we can end the session here.
Yeah.
This is the last question by Lisa. She has written, what do you think about coffee? So any beverage for that matter, tea and coffee.
Yeah. Well, I love coffee. But I have 1 cup of coffee in the morning, black. I don't add anything to it. And I really enjoy my cup of coffee. And I think if you do that, if you drink coffee in moderation and at the right time, it's fine. In fact, there's some evidence in the literature that that shows that coffee is beneficial, and tea the same. The problem lies in if you're drinking coffee throughout the day, and then it's going to affect your sleep cycle. So I always tell patients, if you're going to consume coffee, have it early in your day, and nothing caffeinated after noon.
Okay. Thank you, Doctor, for the wonderful advice. I'm seeing so many questions. Everybody's asking about your book that's kept behind. Yes, that is a book, What's Missing in the Medicine. And you guys can order it from Amazon.com. And the book is very much there, available.
Thank you so much.
I hope
whoever picks up the book, that it serves you. Because that's what it was meant from my heart. And it's really a simple book. And I just want to finish by saying these very simple behaviors, if we all engage in them, it means so much. It can really make the difference between living a disease-free life or one where regrettably there's much morbidity and mortality. So I wish you all the best of luck. And I want to come back, Ritu. Now that we know each other, I'm happy to come back and we can chat more on other topics.
Absolutely. Thank you so much. This is the best thing I heard all day. Thank you so much for this wonderful session, and we just love you. You are not just an a doctor, you are also an inspiration to us, and I'm sure so many people will follow your advice, purchase a book, and it's like you have stepped in our shoes, and that's how you are advocating about MS. You are not just a professional, you are someone who knows us closely. And
Absolutely.
thank you so much for
It's,
all your wonderful advices.
you got it. Thank you so much for inviting me today. And again, I want to thank you for all the important work you do. And if ever I can do anything to support you, please reach out.
Oh, thank you so much. Thanks a lot. God bless
Okay.
you. Have a nice day, doctor. Thank you.
Bye-bye.
Sorry. So Dr. Stancic is just amazing. Truly, truly, truly love her. She's super amazing. And guys, please go to Amazon.com and order her book, What's Missing from the Medicine. Also, don't forget the documentary that she has made, Code Blue. It's amazing. I mean, when I saw it, I got goosebumps. I want to hear from you how you feel after seeing a movie. So thank you so much for joining us today. It was a wonderful session and you were a wonderful audience. Thank you so much. Have a good week. Bye.